Good morning, everyone. Wonderful to see you. I know that there are some folks out in the exhibit area. We'll let people trickle in, and I do want to welcome you. I'm Barb Blodi. I'm the faculty at the University of Wisconsin. I'm a retina specialist. With my colleague Mihai, we are the faculty directors. We welcome you to the second decade, I guess we're in the third decade, of this AMD Symposium. It's really been a wonderful, wonderful collaborative effort. This symposium is sponsored by the Wisconsin Council of the Blind and Visually Impaired and the Department of Ophthalmology and Visual Science. And we really have been a team. We have been meeting monthly, even weekly, to get this program off the ground for you. This is really your program. So please let us know to your feedback, your thoughts, positive and negative. At the front desk, where the registration is taking place, we can write down, we have paper and pencil to write down your thoughts. We can also give you email so that you can send it to us later. So please give us your feedback so that we can make this program even better. I would like to thank the staff at the Wisconsin Council of the Blind for their tremendous effort, and the staff at the Department of Ophthalmology. Chris Temmie in particular has been putting in a lot of long hours on our behalf. Lori, Amy Werf, there's a whole nice group. We've been getting along well, and it's been very productive. I do want to announce to you that what's happening this morning. We will have all of our talks here as usual. This is our usual format for those of you who know it. Our speakers will be here all one after the other. We have more exhibitors this year in this central area. So please take the time to look at the exhibitors. Some are for programs, some are for tools for low vision. You'll see a lot of diversity in the exhibitors, but definitely quite an uptick in the number of exhibitors this year. And then finally, something new in the room across from the exhibitors, so the room that's on the other side of the booths, we will have, starting at the break and going even after the program ends, we will have a team from the School of Nursing, from the University of Wisconsin Nursing School. We'll do some free health screening. We're excited about this. This is a new program that we have to offer. This is health screening for a number of different areas. There's balance screening, hearing screening, memory screening. I'm looking down at my list, blood pressure. So please look, if you're interested, please go and see what's happening with the School of Nursing on the other side of the exhibitions. Just for some basic announcements, the bathrooms are near the entrance where you came in. The women's bathroom is on this side. The men's bathroom is closer to the registration area. There is coffee that's free for all of you, and a concession stand will be, or concession area is opening soon. There you will need to pay for any soda or food that you would like. Today we have a lot of great subjects to share with you. We're going to talk about macular degeneration, its treatment, prevention, research, genetics, nutrition, stem cells. There's a long list, so I hope you're all ready for a very exciting morning. I'd like to start off welcoming and introducing our two speakers who will kick off our program. First, you will hear from our chair at the University of Wisconsin, Dr. Terri Young. She is a geneticist and pediatric ophthalmologist, and she will give you an introduction to what's happening in macular degeneration within our department. After that, we will hear from a board of directors member, Rhonda Stotts, from the Wisconsin Council of the Blind. So let me please welcome Terri Young. Thank you.
It is truly my honor and pleasure to be able to be here today with you and represent the Department of Ophthalmology and Visual Sciences at University of Wisconsin. I want to reiterate what Barb said, and first of all, thank all the engines that made this possible. Wisconsin Council of the Visually Impaired, Also, especially Chris Temme from the Department of Ophthalmology Visual Sciences, and Jessica Arendas, who's somewhere in the back as well, our Director of Marketing, Barb Blodi, Mihai, and all of my colleagues who will be speaking today. I'm actually not going to talk about what's happening in the department. I just thought I would go sort of broad, sort of broad strokes about what's happening actually and why this is important, this kind of symposium and others. Eyesight affects how human beings perceive and interpret the world. It's used for everyday activities, communication, educational, professional pursuits, the care of others, the maintenance of personal health, mobility, independence. Vision impairment in adults is associated with increased risks of falls and injuries, social isolation, and depression. In children, that's my sphere as a pediatric ophthalmologist, could lead to developmental, academic, and social challenges. And those types of challenges happen much earlier in life and can have effects for the rest of life. Increased risk for poor eye health in particular is associated with lower socioeconomic status and poor visual health, and that there are high economic and social costs of vision impairment to patients in terms of types of work that you can actually pursue, how you can support your family, how the burden on the healthcare system and society in general. They're considerable. So, in fact, there's no reliable data on the number of people affected by all causes of vision impairment in the United States. One model estimates that more than 142 million adults over the age of 40 in the U.S. experience vision problems, and these are due to refractive error, just needing glasses, age-related macular degeneration, which you'll hear a lot about today, cataracts that are untreated, diabetic retinopathy that's untreated, and glaucoma. Uncorrectable vision impairment affects an estimated 6.42 million people in the U.S., and just refractive error correction alone affects about 8.2 million to 15.9 million, just having the right pair of glasses. Isn't that amazing in this country? So I'm going to just quote a couple things here. This is a hot off the press new report by the National Academies of Science, Engineering, and Medicine that was published in September of 2016, just last month. That's basically a kind of like a call to arms, if you will, to incorporate vision health into population health studies and into communities in a way that it's never been done before. Most of what we're doing right now is doing work in silos, whether that be in the silo in the university or the silo in, in treatments outside of research settings, just in an incremental way. But this is really just a call to arms to make this really a national issue and incorporate this into all sorts of epidemiologic and population health studies. And it's spurred by these numbers. By 2050, the prevalence of visual impairment and blindness in this country will double. And I've already given you some numbers. And in 2013, the cost of eye diseases in America was estimated to be $139 billion in treatment, in prosthetics and devices, and the like. So the title of the study is Making Eye Health a Population Health Imperative, Vision for Tomorrow. And a multidisciplinary expert committee was convened to examine the core principles of population health strategies to reduce vision impairment and promote eye health in the U.S. And their report proposes a population health framework to guide action and coordination among various and sometimes competing stakeholders in pursuit of improved eye and vision health and health equity in the U.S. They have some recommendations. Those include public awareness programs, better evidence-based decision-making to inform population health initiatives. And what they mean by that is actual true research to make sure that what is being studied properly, and the results are true and actionable. Evidence-based screening programs. Some screening programs out there are actually not ones that are backed by research and don't have validity, if you will. Increased attention to vision research, especially population-based. single set of eye disease clinical guidelines, because again, there's sort of disparate, multiple guidelines or variations thereof. Culturally competent eye care teams. We're a diverse society, and sometimes giving or providing an eye examination requires having a sort of a different cultural perspective for that individual or for that family. And enhance community-based eye health programs. So that's the end of my introduction. I did want to say we've got this eBlast website. It's called Sight 360, and please take a look at that on the web. It gives you an update of all the great things that are happening in the department. One thing I just want to share that's happening tonight is we have initiated some community medical education type programs. It's called Saving Sight Session, and tonight in particular may be something you might be interested in participating in. Our Professor Karen Cruikshanks, who's an epidemiologist and population health specialist, is talking on eyes, ears, and aging. The event starts at 5:30, and it's at the Health Sciences Learning Center at the University of Wisconsin School of Medicine Public Health. And we invite all of you to come. There are refreshments. I know it would be a long day for you, but nonetheless, it should be a great session. Again, thank you so much for coming today. We're honored that you're here, and I hope you have a good day. Thank you.
Thank you, Terri, for setting the stage. It is so important to be mindful of what's happening in the public, what's happening in our government and federal agencies.